Welcome to the part two of the expansion webinar series hosted by the Western Kentucky Opioid Task Force. My name is Cameron Burkeen. I am the project manager for the Purchase District Health Department, as well as the host for the expansion webinar series. So to start off, I did want to thank everybody that has been attending our webinar series, those who have shared our flyer and information, as well as our past, present, and current, or past, present, and future speakers for the expansion webinar series. So before I do introduce our speaker, I do want to let everybody know that we have kind of changed some settings from the first initial webinar. So we do have the Q&A submission feature that is located at the bottom of your screen. We do ask everybody to use that to submit questions to be answered at the end of the presentation. And we have also enabled the chat, so feel free to use that to introduce yourself, what organization you may be from, as well as what location you are calling in from. But without further ado, I did want to address our presenter today, Dr. Brett Sponseller. So, Dr. Brett Sponseller earned his D.V.M from Cornell University, completed an internship in private practice with Equine Medical Associates in Edmond, Oklahoma, and a residency in large animal internal medicine with an equine focus from UC Davis. He earned his Ph.D. in molecular, cellular, and developmental biology from Iowa State University and was an inaugural founder of the Equine Internal Medicine Service at ISU in 2003. Since then, he has maintained an extramurally funded research focus in equine infectious diseases. His teaching portfolio includes didactic equine internal medicine, veterinary virology, graduate and professional students, and equine internal medicine as a clinical rotation. He now serves as the director of the Gluck Equine Research Center and chair of the Department of Veterinary Science at the University of Kentucky. So we are super excited to hear from Dr. Brett Sponseller. We think he is a missing part in this whole Xylazine mystery. So without further ado, I'll let him take over and talk about Xylazine, safe for horses, not for people.
Thank you, Cameron. I appreciate that introduction, and I appreciate the opportunity to share a little bit about Xylazine. And it's a topic that concerns all of us, and there are many different aspects, I think, of the drug that we need to consider. And as Cameron indicated, I am at the Gluck Equine Research Center at the University of Kentucky, which is part of the Department of Veterinary Science, which also includes the UKVDL. So as part of the signature industry of the equine industry here, very, very glad to be a part of this group here. It's an outstanding group. So we're going to focus a little bit on a particular drug and the role that it's playing both in the veterinary context and then as well as the concerns that we have with the drug in illicit use of xylazine. So we'll go through a little bit about what is it, and then its uses, and then kind of this, what's the big deal about xylazine? Why is it something that we're actually hearing? Why can people actually now pronounce it even, where since the 70s, it's been a drug that a lot of people didn't even know how to spell, and now, unfortunately, many do. So it is a drug. It's actually licensed for use as a sedative and analgesic for horses and cervids. Those would be deer, but it's also used in other veterinary species, cats, dogs, many other species. And what it is it is a common equine sedative and analgesic, meaning that it'll sedate the animal, kind of keep them quiet, but also provide some pain relief. And that's actually quite important. There are a lot of other sedatives that could be used, but they don't provide any pain relief. And it acts on alpha-2 adrenergic receptors. And essentially, that's the way most drugs do. They have to bind to a receptor. In a sense, if you think about it, they occupy a seat. And the seat that this drug binds to is the same one that norepinephrine and epinephrine would bind to. And that actually factors in a little bit on how we dose the drug. We have to bear in mind whether or not the animal, the horse, is in pain or excited, because some of those receptors may already be occupied. So that has an important bearing. Also kind of indicates a little bit of what we might expect to see when we do sedate the horse, some of the side effects. Kind of an important thing for this discussion here is the fact that also xylazine and alpha-2 adrenergic drugs that bind there, they're also synergistic with opioids. and both for the sedative effects as well as for the analgesic effects. So together, xylazine with an opioid results in more profound sedation and more analgesia or pain relief. So one of the things about horses too is that when they're sedated only with xylazine and other related drugs that are similar, that they may have a startle response and kick out violently. Okay, and it's a little bit like if you're, attending my lecture, we're into it about 30 minutes and you're starting to nod off, and all of a sudden something slams and you startle awake. Horses will startle too, and when they're sedated, you can appreciate that they kind of may suddenly pop awake, and their response is to kick and to move away. Essentially, they're prey animals, they'll run. And so that's part of the reason why the use of an opioid has been used, is because that startle response and the kicking response is usually decreased or attenuated quite a bit. Horses that are sedated with xylazine may also have disinhibition of learned behaviors. And so we note that horses may become aggressive, and usually what that reflects is that horses no longer have the behavioral limits that they have learned. And so you can think a little bit about a frat party on a Friday night, that there are, with alcohol and maybe even other drugs, that a lot of behaviors, that there's disinhibition of a lot of other behaviors. And to some extent, it's not too far afield here to consider the same thing here with a horse once it's sedated with xylazine. Now, in the veterinary area, I said that, we have to kind of titrate or consider the dose that we're going to give, and that it can be variable depending on how excited the horse is. And occasionally we may overdose a horse, and that has happened. There may be other reasons why horses may be particularly susceptible to xylazine. But there are several drugs that can reverse an overdose with xylazine. So yohimbine was one that was on the market for quite a while, and it's no longer available. Tilazolene, and also falls into that class. Atipamezole is still available. Key thing here, xylazine does have a drug or several drugs that can be used to reverse an overdose of the drug. So that's important because it kind of conflicts a little bit. You get mixed stories with some of the literature that'll come up a little bit later in this talk. There are other drugs that are also alpha-2 agonists. Okay, in other words, they can occupy this same seat. Xylazine will kind of use as our representative drug, but detomidine is another used very commonly, tends to act a little bit longer, provide a little bit more profound sedation. But then also romifidine and dexmedetomidine are also similar drugs. These are all used in veterinary practice. They're all alpha-2 agonists. And so you may, I'm afraid, start to hear more about some of these other two alpha-2 agonists as well. We'll see. I mentioned that the alpha-2 agonists can provide more profound sedation, more profound pain relief or analgesia when combined with an opioid, and one that's used very commonly in veterinary practice is butorphanol. And it is a brand name, it's torbugesic, so you may hear it referred to as Torb. And it is a synthetic opioid that is a kappa receptor agonist and a mu receptor antagonist. It's a mixed opioid. And it'll result in analgesia and sedation of its own, but really the way it's used and the impact is greatest when it's actually combined with an alpha-2 agonist. So we have talked about xylazine and detomidine and several others, and if we combine it with torbugesic or butorphanol, we'll see much more profound sedation. And that's actually used clinically, so that if we need to sedate a horse, and you can see this one's just standing here, he's head hanging, relaxed, standing quietly, no one's holding it. This horse is not going anywhere and is very probably sedated with both detomidine and butorphanol. Here, I'm just showing a video clip. It's a horse that actually has equine asthma. And kind of the important thing is to just show you that many times when we work up cases in a hospital setting, we're going to have these horses in a set of stocks. But the stocks are, many horses could jump out of these quite literally. So one of the ways that we make it safer for everyone is to sedate the horse, and we'll often sedate them. It'll be usually a pretty profound sedation that's required, particularly if, in the case such as this, we're going to do a bronchoalveolar lavage, where we're going to pass a tube that's about 8 foot long with about a 1 centimeter diameter down the nasal passage, down the trachea, and into the thorax, into the lung field, and collect some fluid there as a sample to determine the cell type that's driving that asthma. So, as you can imagine, if we're going to do that, we need fairly profound sedation. This is another horse standing in the stocks. You can see we've got some equipment around it. The person at the head of the horse is actually trying to see if the horse has any appetite. So, sitting there with a little bit of feed in front of it. This horse has severe pleural pneumonia. It's got pneumonia, but accumulation of fluid in the thoracic cavity as well. That's going to have to be drained. And this horse is very ill. These are different horses, but these are examples of horses that have this condition where we've placed drains into the thorax, and in the bottom, we're actually, in this case here, we're delivering fluid. So we're doing pleural lavage where fluid goes in and it gets drained out and collected into a bucket. But as you can imagine, placing these tubes in this way, that these are actually human chest tubes, by the way, if you ever have to have this performed, that's the size, same size we use in the horse. Kind of gives me the willies, but anyway, you need to be fairly well sedated, and you want to have some pain control that goes with it. For other things, sometimes we need to do surgery. This could be surgery. This is at the south end of a northbound horse, but here they're probably doing either a perineal urethrostomy. I'm not sure if this is a gelding or a mare. It could be a mare that had foaled out that needs to have a rectovaginal fistula repaired. But either way, standing is much better for certain surgeries. And so not all of them are done under general anesthesia where the horse is recumbent and lying down, but standing is often the way that we prefer to do it. So we use these drugs to achieve a level of sedation where the horse is still standing, where it's comfortable. And then we do also block the area with other drugs to numb the area as well, or do a caudal epidural to block any pain in that area where surgery is going on. In the equine world, horses have teeth that continually erupt until they lose them when they're, say, about 30 years of age or so. And so given that, they tend to have edges of their teeth that become sharp and they need to be filed off. Sometimes teeth need to be removed. Other problems can arise. But in order to do procedures like this, we need to have the horse sedated. And as you saw when I first introduced it, the horse was resting its head on a chest, but here you can see there's a stand. The horse has its head in the stand, it's resting comfortably. No one else is holding the horse in this image, not the way we usually handle it, but it points to the fact that there's actually quite a bit of relaxation and control here with the sedated horse. And this is motorized equipment that's actually filing off these sharp enamel points to the horse's teeth. And this is another example here with a horse in the set of stocks. With the mouth speculum, where they're doing an oral exam, and they'll be doing probably a similar procedure. So again, coming back to it, an alpha-2 agonist with an opioid provides a very nice plane of sedation that can be very useful for typical or lengthy procedures. So again, that kind of reviews a little bit how it's used with horses. Again, 1,200-pound animals that we often need to stand very still. Often after that, if we need to block them in order to numb areas, we're talking about, again, inserting needles into them. They respond to that. So sedation is a key thing. Here we're going to start to kind of shift focus into addressing a little bit more about what the big deal is, and kind of introducing this through the Journal of the American Medical Association's original talk about xylazine and overdose deaths and forensic drug reports. And this really kicks in about 2019 to 2022, and this is the period that this kind of reviews. And the key thing here is looking at to what extent xylazine has been reported in fatal overdoses, and with law enforcement drug submissions, has it been detected among different states. And in 2019, there were only 16 states with no reports where it was not detected. In 2022, it was down to 2. So in that 4-year period or so, there was quite quite a spread of the detection, at least of xylazine. It may have been there before, but at least now people are aware of it, looking for it, and we're detecting it. By 2022, there was quite a bit of an increase with 43 states reporting xylazine-related deaths. So that's a dramatic increase. It's pretty startling. Um, and then it was actually somewhat regional as well, with the highest detection in areas of the Northeast and Mid-Atlantic areas. So kind of the upshot of this is that this, study was that by the end of 2022, xylazine-related deaths were highest in the eastern states, but the detection was very widespread. And the key thing here with xylazine-related, this is not death due to strictly xylazine alone, but where xylazine was also detected. Xylazine alone does cause severe respiratory depression and so forth, and it is a risk. It's something that we're aware of in the veterinary community, that we'd be very careful with these drugs in case of accidental exposure. So this kind of shows still the continuation of this study that we can see in 2019, that there were kind of very few reports. It was somewhat starting up at that time, and then more focused in the Mid-Atlantic area and the Northeast, Connecticut, New Jersey, and then in 2022, even more widespread. This is shown a little bit more directly in this graphic here with actually, I'm originally from Delaware. So this is one of those things that's not so great to find out about your home state, but led in reports where xylazine is detected and reported in drug screening. So it was found in the Mid-Atlantic area, Delaware, Connecticut, Maryland, DC, New Jersey, Rhode Island being the major states, and a few others. And then for the period under the study in 2022, this is where we were with Kentucky. So much lower rate. Kind of the good news is that more recently, so this is a report out of the by the CDC that I beg your pardon, that focuses from September of 2023 to September of 2024. So this 1 year period, that there was actually a decrease in the number of predicted or reported deaths. Okay, so this is showing the reported deaths, still with the predominance in the East. But at least there was this decrease, and this is plotted over time, going from January of 2015 through January 2024 and a few months afterwards. And so if we look at how this has increased from the number of overdose deaths nationwide being about 50,000 and then growing to a very alarming height above 125,000 at one point, well, 100,000 at least, and then tapering off more recently. Kentucky, it kind of followed the same curve. Numbers obviously a lot less, from going from above 1,000 in 2015 and then spiking here in this 21 to 22, 23 period, and then more recently, as indicated, also dropping here in Kentucky. Okay, and this would be based on survey data that dates up to February 2nd of 2025. So one of the big questions is, where's it coming from? And when I first started hearing about xylazine-related deaths or reports or drugs being illicit combined with other illicit use, that it was kind of concerning that, is any of this coming from the veterinary pipeline? So that's a big question. So to really address it, though, we have to take another look at a different opioid, and that's fentanyl. And what is fentanyl? And I think a lot of people have heard about it, probably well aware of what it is, but for a quick review, it is a potent synthetic opioid drug. So I had already talked about one fairly potent synthetic opioid, and that was butorphanol. This is different, but this one is actually quite powerful. And here they're showing in the what was a report that I pulled out from the DEA, that they're showing kind of a lethal dose of fentanyl. It takes very little. It is approved by the FDA for use as an analgesic, so it's approved for pain relief in humans. It's also used in veterinary species, predominantly small animals, cats and dogs. It is about 100 times more potent than morphine and about 50 times more potent than heroin, and that may be why it became of interest on the street, where it has a lot of different names, some of which are named after movies that I've seen, Goodfellas, Tango and Cash, but never knew that these were the others. So how is it consumed? A lot of different ways. I'm not going to really go into that, but very often it can also be combined with other drugs on the illicit drug market. And then probably worth a little bit of focusing on what it does to the body. And it's very similar to other opioid analgesics, opioids that block pain. Fentanyl produces effects such as relaxation, euphoria, pain relief, sedation. In many cases, these can be the good effects of the drug. Also, though, can cause confusion, drowsiness, dizziness, nausea, vomiting, urinary retention, pupillary constriction, which is why very often when people are examining uh, people who have been or suspects of using drugs, that they will check the pupils of the patients or whomever, and then also respiratory depression. One thing I'll point out right here that we have in the family of opioids, they cause respiratory depression, and also, as I mentioned earlier, xylazine itself and the alpha-2 agonists, alpha-2 adrenergic agonists also cause respiratory depression. That's, in a sense, what we learn as the major risk for accidental injection or ingestion of xylazine and the other alpha-2 agonists. So for fentanyl, you know, it can be a real problem with overdose where we'll see stupor, changes in pupillary size, clammy skin, cyanosis, and again, this is dealing the blue tinge of the skin of an individual related to, or the mucous membranes and gums related to this respiratory suppression and depression, as well as possibly coma, and then the failure, respiratory failure, which leads to death. So very clearly, overdoses of fentanyl resulting in death, very real possibility. When we're examining patients, and this is not when I say we, it's the collective we, this can be veterinary patients, but with humans, we're looking at if the patient's comatose, if the pupils are pinpoint, if there's respiratory depression, then that really suggests an opioid intoxication. And I can say that actually from firsthand experience too, had a daughter in the hospital that had abdominal surgery and was put on a morphine drip and actually ended up with intoxication and had to be reversed. Not a lovely thing to see, but many of these signs, her respiratory rate dropped precipitously and significantly, and so pretty much understood right away what was going on. Good nursing team helped there. Both, again, butorphanol and fentanyl are opioids. Okay, so keep that in mind. So we have drugs where we've talked now about butorphanol being an opioid. We've talked about the fact that we get profound sedation and improved pain relief when it's combined with an alpha-2. And so I think you can start to see where I'm going with this, that maybe the same effect is sought after in a way by combining fentanyl with xylazine and perhaps other alpha-2s. Yeah, very concerning. So classically, and I think a lot of people are aware of Narcan. Hang on a second. Hopefully, yeah, there it is. Narcan as a way of reversing the effects of opioid toxicity and intoxication. And naloxone can be provided, very often it's provided as an intranasal delivery to reverse the effects of an overdose of opioids. And so these are now available. I mentioned that we're doing two things here. For example, in our veterinary department, one is that we're going to get a defibrillator, one of the external automatic defibrillators, and on top of that, we're actually going to have Narcan on hand. We are on a university campus, there are students, and so that's something that we're going to have available. So I think more and more places are considering that as well and just being aware of what's going on. So naloxone can be used as a reversal agent for overdoses with opioids and have used it clinically as well. Usually it's going to be our anesthesiologists who are going to be using naloxone. So I guess the question then too is where is it coming from? And this was first looked into, well, maybe first. This was actually very well characterized back in 2020 when we started to see the spike where the DEA looked into it. And it turned out that, well, yes, while Mexico and China are the primary sources for fentanyl and fentanyl-related substances that are coming to the U.S., India is also emerging as a major source of fentanyl powder and fentanyl precursors. And this is the cat and mouse game that's being played where precursors of the drug that are not yet deemed illegal may be brought into the country where then they can be altered to become active drugs. Or they can just be used as they are, but they're not actually described as being illegal. So this kind of depicts here the flow from China and India, and predominantly into Mexico and Canada, and then into the United States, although there are apparently direct routes straight into the US as well. And so this has caused a lot of consternation and actually political recent political concern. I'll use this. And so this is just fairly recently, as I was kind of thinking about putting this together and just pulling little snippets that just happened to pop up in the news where I was looking. I tend to follow the BBC and sometimes CNN, but here you can see on March 4th of 2025, we have China and Canada immediate retaliate against Trump's tariffs. And it's like, okay, well, what's the big deal there? And what's that all about? Well, that was about this. These tariffs were placed largely and with the rationale that Canada and Mexico are failing to do enough to stem the flow of fentanyl, opioids, and other opioids into the United States. Those countries reject this, say that's not the case. They have responded to it, but this is kind of the argument that's going on. So at least this is kind of the backdrop for what we're hearing about in the news quite a bit. So what's the big deal now? Well, more recently, we have the fact that xylazine is making the deadliest drug threat, i.e. fentanyl, that our country's ever faced, even deadlier. And so the DEA has seized xylazine and fentanyl mixtures. Okay, so when it's xylazine related, very often it's xylazine and fentanyl, this mixture, in 48 of 50 states. And that was at the time, and I don't have when this occurred, but this is 2022. The DEA laboratory system reported that 23% of fentanyl powder and 7% of fentanyl tablets or pills that were seized by the DEA contain xylazine. Again, this alpha-2 adrenergic receptor agonist, xylazine, combined with an opioid, in this case fentanyl, enhances the effects of the opioid. So let's look at how xylazine's viewed from not the veterinary side per se, but where we're considering drug abuse. So this is a bit of a report by the NIDA, the National Institute on Drug Abuse from NIH. And xylazine is often referred to as tranq because it's a veterinary tranquilizer and it's found in a lot of other illicit drugs. And many people that are actually think that they're taking fentanyl for whatever reason, wherever they get it, often it is laced with xylazine. And again, we now understand why that's a problem. Xylazine itself can slow breathing, heart rate, and blood pressure to dangerously low levels. And then the respiratory suppression, again, is a key factor here. And they state, NIDA states that overdose reversal medications do not reverse the effects of xylazine. And to be clear here, what that really refers to is the fact that naloxone does not reverse xylazine. Tilazolene, atipamezole, yohimbine, those drugs do reverse xylazine, but but naloxone will not, or related drugs will not. Still, if there's some thought that perhaps there is xylazine contamination in drug or present, still recommended to go ahead and reverse with naloxone. Very, very often that's going to be the main component to address anyway. So, what are the other risks? Well, xylazine use also results in significant skin wounds and open sores or abscesses wherever it's injected, and that is in people. And we actually don't see this in the veterinary situation. So I've never seen abscesses or at least ulcers develop with the injection of xylazine. You could get an injection abscess just if you get like a staph that's carried in, but that's not something that's typical. So there is quite a bit of research that's going on in this area, and then including how and why people, are taking synthetic opioids like fentanyl. So sorry for this. This to me is just absolutely disgusting, but I think it's fair enough and the shock value is worth it. But these are the types of lesions and all sort of lesions that you see on arms of addicts who have injected fentanyl laced with xylazine and the effects that it has. Usually requires skin grafting, and that's what's shown here. And after a month, there's usually some fairly significant improvement, but it kind of speaks to really what some of the problems are that addicts taking fentanyl laced with xylazine are going to experience. So again, the number of drug overdose deaths involving xylazine has grown. And remember, this is usually not going to be xylazine alone, but xylazine detected in the company of other drugs, usually fentanyl, but it has grown quite a bit. 102 in 2018, 627 in 2019. These are reports out of CDC, about 1,500 in 2020, and doubled again here in 2021. And it's, again, as we know, it kind of leveled off. I wanted to provide, though, a little bit of context that, yes, this is actually quite concerning, and some of the trends are quite concerning, but we often lose sight that there are about 178,000 people that die each year with excessive alcohol use and the accidents and other related problems, including cirrhotic livers and so forth that occur with that, alcoholic cardiomyopathy. So there are a lot of other things, but that's still something that we seem to kind of dance by, and for whatever reason, I just have to throw that in there, is that also kind of is something I think that we need to focus on to some extent in our society as well. There are a lot of other aspects, I think, to be aware of too, and this is something that's being considered here. The Kentucky Board of Veterinary Examiners put out a newsletter very recently, just in March 2025 here, so just this month. And part of that has to do with the allied health professionals and how there may be some changes allowing other people other than veterinarians to administer sedation. So there was a bit of a poll in the veterinary community to find out, well, what do you think? Should it be veterinarians that are the only ones or that can administer sedatives, or should it be others, say technicians or other health professionals that have training that should have the ability to give sedatives? 1% of the providers, according to this survey, should be provided unlimited access to sedatives to administer at will on patients, meaning that people who have training but are not veterinarians could do it on their own, not even under the guidance of a veterinarian. So again, a topic though where at least more than half think that a veterinarian should be the only person, but there are some changes that are afoot too, probably in the way sedation is being managed. We'll see. More recently, in the AVMA news, xylazine and here very clearly listed as illicit xylazine use combined with fentanyl has been decried an emergent threat. And so the Biden administration, before the change in administration occurred, designated fentanyl combined with xylazine as an emerging threat. And this designation actually allowed for some changes to um, be taken by the federal government to try to combat the drug supply. So it opened up some possibilities um, for how to counter it. And then this was the first time the United States declared a drug as an emerging threat to the country. And so by doing this, different tools could be used to combat it. And so they are, and this is um, being addressed with evidence-based strategies to try to reduce the drug supply and reduce the impact it has. So as you can imagine, American Veterinary Medical Association, the AVMA, is very clear in stating that xylazine is a safe and effective prescription sedative and analgesic that's used in domestic species, as well as the cervids, for which it's also licensed. That'd be the deer and the elk and other related species. And it's used in many other species, and it helps calm them and help with handling these animals safely. Again, I kind of pointed out, keeping a horse in a set of stocks and being able to do that safely, or to work on it in a barn without stocks, that sedation is actually very necessary. So a key point too is that the AVMA believes that there's not significant diversion of xylazine from veterinary channels, and I would extend that to also include detomidine and other alpha-2 adrenergic agonists. There is going to be some, no doubt, but it's not a source that makes good sense, probably in the illicit drug supply or need. And also, I have to say that veterinarians are usually very much aware of the danger of xylazine, and so it is usually very carefully monitored. The drug is not approved for use in people, and in humans, it can cause serious and life-threatening effects. But as a contaminant, as we mentioned, it's been well appreciated that that is a big concern. Right now, there is some legislation. It was initially introduced back when uh, President Biden was in office. And so this was actually very nearly a year ago that it was introduced, and it was bipartisan and had quite a bit of backing. And that bill didn't quite get off the ground then, but has actually been a renewed attempt has occurred, and we anticipate that that will hopefully go through. So we do think that that we need to focus on the illicit use of xylazine, and by this I would say that focusing on fentanyl that's laced with xylazine is probably the way I would picture the focus, but that would address the predominant concern about diversion of the drug, and that it's not really deemed to be coming from veterinary sources. Sure, there's some, probably more than I'd like to acknowledge, but that doesn't seem to be a major source. So this is actually fairly current from the February 18th of this year. It kind of reviews a little bit more, but again, the AVMA is kind of renewing an update and pointing out that this legislation is actually coming back around, and we have great hopes that it's actually going to pass. So using the momentum of the last Congress, the AVMA continued working with lawmakers on both sides of the aisle to secure the backing needed to reintroduce the bill, the new Congress. Okay, so again, this was done in February, and it actually has had support both in the House and the Senate and across party lines. The DEA and the USDA both support this legislation, and then the DEA has actually called this bill out as a bill that should be signed into law. So again, I think hopefully this means that we're going to make some traction in this area with the use of xylazine. And so we'll see how that's going to progress. We need to see if we can have this bill pass to hopefully mitigate some of the unintended consequences that could arise to the veterinary community if this bill does not go through. Because as it stands now, this then will allow veterinary medicine to continue with this drug as a class 3 drug. So scheduling of xylazine by the DEA without these changes will limit how veterinarians can use it. And that would be very, very detrimental. And I would point out too that it would not probably be just xylazine, but it would be also dexmedetomidine, detomidine, romifidine, all of these related drugs. And that would make doing a lot of routine work on horses and other animals very, very difficult, and also more costly. Um, so xylazine restrictions are currently being enacted by state, and this kind of patchwork is something I think that very the AVMA feels very strongly that we should avoid, and I guess I will echo that too. I'm shifting focus a little bit here. This goes to the MMWR, the Morbidity and Mortality Weekly Report that's published by the CDC. So as you can say, well, good. It sounds like we're making traction in one area. Maybe this legislation will pass. Maybe that'll help kind of control xylazine presence in fentanyl, and maybe it'll help also get more control over the flow of fentanyl into the country. But more recently, there's been a detection of other drugs that are related. So these illegally manufactured fentanyls and carfentanil are still present. And in 2023, we had approximately 72,000 drug overdose deaths, and nearly 7 in 10 were related to fentanyl. So that's kind of a big concern there. The bigger concern I would say now is that they're also seeing other fentanyl analogs, and carfentanil, which has been around for a while, has actually made another appearance. So it was kind of quiet through since 2016 to 2017, but we're starting to see that again. Xylazine too, this is just days ago, March 20th, 2025, that we're starting to see more xylazine detected in California, coming up from Mexico through Tijuana, that area. And it's kind of interesting about how much xylazine was detected. 100% of participants' urine, so people that were taking these fentanyl-related drugs, okay, tested the urine, tested the drug paraphernalia that they were using, and it actually had kind of widespread detection of xylazine. So it's there. There's no doubt. And that's kind of the major concern, that it's coming again across the border, and a lot of the fentanyl and fentanyl-related carfentanil and other fentanyl analogs into the U.S. So again, we've talked a little bit about it in the context of veterinary medicine. We've seen a little bit about how xylazine in the context of fentanyl probably enhances the danger of fentanyl, the effects of fentanyl. And we're seeing that this problem has to be weighed against the veterinary need for it as well. So this is kind of the balance where we need to kind of examine xylazine and hopefully craft the legislation that'll be protective for veterinarians, but also mitigate the concern for human deaths. A very real problem, a very real concern. So this kind of, I'm popping back here. This is just a little tag on here. But the legislation appears to be going through, and it does seem to be gaining traction. I don't have any updates beyond what basically February. I tried to track it again today to see where it is, and I can't get any more of an update. So if anyone else has any more information on that, where this legislation stands, that would be appreciated. So that concludes my talk, and I'm certainly happy to take um, any questions that there may be.
Yeah, so we'll just open it up for questions
Oh,
now.
hang on, I can't hear you, Cameron. Sorry. Are you muted by chance?
I came off mute. Can you hear me now? Dr. Brett, can you hear me?
I can now, yeah.
Okay, perfect.
Yeah.
So we did have one question come up, but we'll open it up to the group as well to ask any questions. But if Xylazine kind of used as a last resort in the veterinary practice?
It's not used as a last resort. It's actually one of the first drugs we would have. So I'll give you an example is that in all of the treatment rooms that we had where my last was at Iowa State University, we had, generally speaking, we had xylazine on the shelf, determinine on the shelf. Okay, so and part of that is because, as you can appreciate, if a horse is going to panic, um, and we need to sedate it immediately, the drug needs to be handy. So it's often one that we use, for example, to even some horses get a little claustrophobic even coming into the exam room. So we might even sedate it prior to even going into the exam room. So it's used, quite a bit. I was in a teaching hospital, so I had to look out for the safety, not only of the clients, the horse, but also the students, technicians, residents, interns. So a lot of our horses were sedated. There were very few that were trustworthy enough where you would feel that they were safe to just walk into the stocks and stand quietly. Some would, but a lot of them were a little apprehensive. This is a new environment. And even similarly, a lot of horses learn very quickly that veterinarians aren't always the most, the nicest people to have around. That some things happen that may be uncomfortable. Even if it's paring out a foot abscess, that can be uncomfortable. So simple things, suturing lacerations, working on the eyes where you have to have the horses stand perfectly still, doing rectal exams for detection of pregnancy, those sorts of things all require restraint of the horse, and in some cases, these types of drugs to reinforce that and make it safer.
We did have another question come through. You'll have to share your screen again for this one, but would you be able to share, go back to the graph about deaths in Kentucky related to Xylazine?
Yeah, and hopefully. Well, okay. Can you see that or not? Whoops, just canceled out of it. Cameron, can you see that or not?
I'm not able to know.
All right, hang on one second here. I'm going to share this one like this. Now, can you see it?
Yes, but we can see the sidebar as well, so you might just want to
Yeah.
go back into presenter
Uh,
view.
I'll just leave it like that if it's okay. That way, if there are any other questions, I could pull it up a little faster.
Okay, yeah, perfect. That works out.
But so this is the graph. So we had over 1,000 deaths related to overdose. And this is actually back in 2015. And then these are all drug-related deaths. And it increased up to about 2,500 through from 2021 to 2023 and then dropped off again. And again, for the US, it's kind of a similar curve.
And we have a few more questions come through. So, you may have talked about this, touched point on it, but do horses also develop xylazine abscesses?
No, that's the horses do not. I indicated that you can see just for any type of injection, sometimes an injection abscess, depending on where you're giving the injection site, if it's not clean enough. That can also happen in humans if there's normal skin bacterium that's actually dragged under the skin. So that can happen as well, or just other contaminants in the environment that are drawn in. So that's possible, but we do not see the sloughing and ulcerative lesions that humans get. I don't know why that is, why it's so profound. My understanding is that that's not at all what's seen with other drugs that may be injected IV. But for xylazine, it does produce these ulcerative lesions in humans. To my knowledge, it's not used very much in other hominids like, chimpanzees, but I haven't heard of it being a problem there either. Don't think that's probably the drug that they would start with, though.
Gotcha. Another question. Are xylazine related deaths more related to overdose or the wounds?
The deaths are related to the overdose. The wounds themselves that we see are just ancillary side effects, if you will. I mean, I was also watching, so this is kind of one of those things, it's a little bit interesting, but they have people that are going out to cities where it's known that fentanyl is a problem, fentanyl, and now we can appreciate that if there's xylazine that's added to it, that it's much more dangerous. And both xylazine and fentanyl cause respiratory suppression. But a lot of these people do when they're surveying folks in these areas of predominantly the city, at least where the drugs are, and you can kind of focus in on it, just due to the population. A lot of what they're doing is just trying to make sure they're still alive, still breathing, um, and that's because of this respiratory suppression that's seen. One little, since we have just a few minutes here, I'll just share that I have had a colleague that was going to sedate a horse, had detomidine, and was going to use detomidine. 5 milligrams of detomidine would be just a small volume, very little bit. It goes into a small 3 cc syringe, typically is what we would use and inject that. And we use that very often just, to do routine work. And at the time, he was in equine practice alone. He was going to sedate a horse. It turned out that he didn't need to for whatever reason. And because he was there talking, he actually slipped the syringe into his back pocket. Okay. Cap came off the needle. And when he sat down into his truck, he actually injected himself in his rear end. So an intramuscular injection, hold dose. And he went to, he was actually, maybe this wasn't the best judgment, but he drove himself to the emergency room, pointed out that this is what he was aware that this could be a problem, and they just monitored him. He didn't die or have any problems with that, but it's, so I think that key thing there was, yes, there was probably some respiratory suppression. They monitored him. Did they reverse it? No. I'm not even sure they had the drugs to reverse it in the hospital. We have it. They might have, but it's not something that they wanted to do. Whereas with the veterinary patients, we do have the drugs and often, consider reversing them. There are some people that perform equine dentistry that will sedate the horse heavily, and then right when they're done with the procedure, will reverse them. Okay, so these drugs are effective for reversal. They do work. In people, it seems that in human healthcare, maybe they're a um, little less likely to actually use them, though, if there's a suspicious or concerning known use of the drug.
Interesting. Um, I don't, I couldn't imagine getting stuck in the behind with that,
Yeah,
but
now it's going to be a bad day when.
yeah, exactly. We got a couple more questions. So you may know the answer to this. I'm not for sure, but how do you by chance know how quickly the ulcers happen in humans?
No, I don't know how quickly it is. That's a good question. I don't know. I think it's actually the way it looks is that it's related to probably um, and this is only speculation on my part. I haven't actually chased it down, but probably alters the blood flow to those areas significantly. I know that, we mentioned how it alters blood pressure, but it also likely has very pronounced effects on local blood vessels as well.
Interesting. I feel like I've seen maybe some studies say where it's just maybe more with chronic use, the ulcers and abscesses. So I think that's
Yes.
just the ongoing study. So another question. This is I'm not for sure where this person is located, but they are noticing increased amputees. Would you by chance have any data to support that it may be from xylazine?
I don't know if that's the case, but that would be probably a hypothesis that NIH is chasing down. So
Mm,
no, I didn't come across that when I was doing any of the reading or prep work for this talk.
yeah. And we got another question. So, would you by chance know how long it takes for Xylazine to wear off in horses?
Oh yeah, that I do know. So I mean, if we were to sedate a horse fairly heavily, generally within 30 minutes, the horse can, say for example, go into a horse trailer safely, walk into it, and then be safe enough for a trip home. Ballpark. Some horses might be 45 minutes. With the Tomidine, it may take a little longer. But it is something that very often, if we're doing something that's painful, say we're doing a laceration repair, we have to clean it, prep it, block it. So we use lidocaine or a similar drug, kind of like when you go to the dentist to numb things. So we would numb around it, then you'd have to suture it, um, wrap it. So it may be something that takes, let's just say it takes an hour. Well, very likely you're going to have to redose a few times during that laceration repair, depending on, the horse, how well it stands, any other stimuli around it. So that can take a while.
Would you by chance be willing to share your slides? So maybe I could email them out to all the attendees.
Yeah,
Yeah.
happy to. I kind of put them together. There's a lot of text in these slides. I usually don't quite do it that way, but part of it. So yeah, I'm happy to email them to you and you can send them out. Hopefully there's enough text. And I do have also the websites from where a lot of the data came from or citations so that people can chase it. If they have more questions, they can chase it down.
So I think that's all the questions I have. Um, so we do appreciate you putting time out of your day to speak to all of us. Very informative. I really think it was a great addition to the webinar series. I think it was like a missing puzzle piece to the whole Xylazine um, mystery that we have going on. So I also want to thank all the attendees and once again, everybody that has shared the flyers as well. But we do want to acknowledge that we do have our last part in the expansion webinar series on April 23rd. It is also going to be at 10 a.m. Central Standard Time, but we have Shayna Doyen. She is the system manager with Antimicrobial Stewardship Infectious Disease Council, as well as the co-chair for Baptist Health System, and she's going to be talking about breaking hearts, the deadly link between drugs and endocarditis. So, we want to appreciate everybody that has been in attendance, but there will not be a certificate of completion for any of the trainings. That question just came through. It's just attending and getting that good knowledge. So, we appreciate everybody and we'll give you your day back. So, have a good
Yeah,
rest of your day,
thank you.
everybody.
I'll extend my thanks for attending too.
Well,
Good series.
appreciate it. Thank you. You have a good rest of your day.
You too. Thanks. Bye.